Good afternoon. I have the pleasure to announce you that you're going to have simultaneous translation because I didn't get to the point of translating the PowerPoint. So, aller plus loin, going further with PROFAN is first prevention, reducing overdose, and also training peers and giving access to Naloxone. So it's really in that order that you have to see this program. I think so. The organization Metadam is an association of drug users with opiate dependency, and they are opiate users. Our principal mission is to empower people and is to improve the quality of life of people using opioids, like on methadone or even active users. We also have 22 apartments for reintegration in the community. PROFAN is a response to a recommendation from the Organization of Narcotic in the United Nations. So it is the Commission of Narcotic of the Nations Unies who was recommending in 2011, because of the rising of overdose around the world, it was very imperative to include Naloxone in the process of services. So that was the resolution 55.7. So from there, the objective of the program for the users is to recognize the sign of symptom of different and make difference between the different overdose, because in the training we talk about also stimulant overdose, and it's very important to make the difference because they do multiple use, not only heroin, and sometimes they use stimulant. It's very important for them to identify the different overdose. It's also to train drug users to be able to do RCR, or CPR, I think in English. It's also to give them the power to act in a situation of overdose and be able to call 911, which is a difficulty with drug users. It's also to diminish the amount of disease by overdose. The objective for the community is to elaborate a strategy that will permit to many medicine doctors to be partner in this project and to prescribe Naloxone to the participant who follow the training. It's also to demonstrate the feasibility and accessibility to project of prevention of overdose and giving access of Naloxone in a démarche to give access with peers. It's also to document, evaluate this action towards with the pilot project that was the first year, and to implement a system to collect data. Also to give community tools to face overdose, and that means first respondent, emergency ambulance, police, etc., etc. The program is constituted of two training. It's one short training of 2.5 hours and a long training of 5.5 hours. The short training does not have CPR. There's also, I'm looking for my words a little bit. There's also trainings that are, the first class is prevention, education related with overdose. The second class is to take action in front of overdose. It's also to recognize the sign and symptom of overdose. Opiates are the drugs. It's also a technique of reanimation, and it's also using Naloxone. You see that naloxone is always in last because we don't want to use naloxone, we want to prevent overdose. Who are the peers, the training peers? Because this program is done with peers. So we've trained peers to be able to transmit information to their peers. They are users that have used opiates in the past. There are users that use opiate and use other drugs. There are also people that work in resources like NGOs in Montreal, and those people sometimes maybe also be users. Who are the participants in this program? People who use or have used opioids. Also people who had used drugs. Also people who work in the resource. It's important to know that in the workforce, the personnel who works around in the resource are also trained and maybe also drug user. All the participants get an attestation card that gives, it's like a attestation that says they can give naloxone. In conclusion, PROFAN is a response to the community. You have to know that the peers at our association start writing this program in 2013. Partners came later on in 2014. There was CRA, Hôpital Douglas, Département de Santé Publique de Montréal, and the Ministry of Health of Quebec. Right at the beginning of the activity, the peers of the NGOs organization, pharmacian, and the network will work together in this program. From the first beginning, 18 months now, 378 people will be trained, and also 21 people were saved as the 31st of July. We are observing on the field a change in attitude with the people that receive the training. They have a feeling they become part of something and that they have the power to do something, and that put them more responsible in their drug use. Anyway, it has to be verified through research. It's just an observation that we do. Actually, Mr. Michel Perrault is doing evaluation on that subject. We have recommendation to do with this program is naturally to set a similar program as PROFAN with peers everywhere where it's possible, so the drug user can relate to their peers and be comfortable to receive training. It's also important to train the people that are in treatment. Let's say people on methadone. It's very important to have them trained also because they do relapse or they do overdose, and it's very important to have them trained. Whoops, sorry. It's important also to think maybe to have a solution for people that have pain and are using opioid. Maybe there could be a recommendation for them to have a training like this. It would probably save lives. And also it's very important to have peers working in the street to be able to give training one-on-one so they can reach people that are very difficult to be reached. In places where people don't go. So it's very important to be able to do that also. So that's the next step that we're trying to set, is to have people going in the street workers or proximity workers, to be able to meet people in the street and be able to do a training, what we call a very short training, so they can be able to administrate naloxone. Thank you very much.